Good afternoon, everyone. And on behalf of the L. Douglas Wilder School of Government and Public Affairs at VCU, welcome to the November installment of the Alumni Lunch and Learn series. Today's session is housing very and extremely low income individuals and families with our speakers, Dr. Calvin Johnson and Chelsea Dunn. For those of you who are joining us for the first time, the Wilder School hosts free virtual events like this one monthly. Each session features change agents, thought leaders, and policymakers who provide insights and commentary on relevant topics of the day. My name is Stephen Dozier, and I'm the Director of Development and Alumni Engagement here at the Wilder School. Before we get started, I'd like to share a few announcements. We're excited to announce that we're rising in the rankings. The Wilder School is the #1 graduate program for public affairs in Virginia and is in the top 15% of the nation. We are 35th amongst public affairs graduate schools and 29th in public management and leadership. We are very proud to be at the forefront of our field. Our spring 2023 Wilder School program application deadlines are extended until December 1st, so apply now. On our website, you can find information for the fall 2022 Wilder School graduation on December 10th. Congratulations to those who will be graduating this December. Our most recent edition of the Wilder School in Action magazine is available online, so check it out by clicking the live link on your screen. Also, you can check the chat box for all the links to the announcements that I just shared. And now to present our moderator, Wilder School Dean and Professor, Dr. Susan Gooden. Dean Gooden.
Thank you so much, Stephen, and welcome everyone. We're delighted that you are joining us for this month's Alumni Lunch and Learn. I know it will be a very engaging and timely topic as we explore issues related to housing, especially among those who are most vulnerable in our population. Stephen did a great job giving an overview of some of the initiatives within the Wilder School. I do want to underscore that for the master's programs, the deadline to start classes in January is December 1, and that we have 2 fully online master's degrees. So with the Master's in Public Administration and the Master's in Homeland Security and Emergency Preparedness are both offered fully online. For those who might be interested in engaging in an online format. Today's topic, it also really relates to 2 of our centers and institutes that I want to profile. First is the Research Institute for Social Equity, which advances equity research in a variety of formats and for policymakers. And our moderator, who I will introduce shortly, is a senior research associate at RISE, the Research Institute for Social Equity. You'll see that a lot of the topics that are being discussed today are squarely within that domain. And similarly, we also have our RVA Eviction Lab, that focuses on issues of eviction. And I want to share that we're very excited to announce their launch of the Virginia Evictors Catalog, which is a database that catalogs property owner plaintiffs who have filed tenant evictions across the Commonwealth of Virginia. So this is going to be a wonderful data source and source of information for public use, as well as for policymakers and researchers who are interested and knowing more about Virginia evictions. And then finally, The Triple Pandemic is a book that has been edited and chapters contributed by many faculty across the Wilder School. The title of it is Racial Equity, COVID-19 and Public Policy, The Triple Pandemic. That will be available in early 2023. And we have information that we will share with you in the chat about how to order that. So again, I think having this work that focuses on health, economic, and justice impacts of COVID-19 relative to racial equity, it's a very timely volume co-authored by many individuals within the Wilder School. So our moderator for today's session is Chelsea Dunn. Chelsea is a senior research associate at the Research Institute for Social Equity. And she has more than 8 years experience in public health, health psychology, program facilitation and evaluation, and health equity. Most recently, she received the very competitive 2022 VCU Quest Fund that is supporting her research, and she is studying equity within housing programs in Virginia, which makes her an excellent choice as our moderator today. And she's particularly focused on housing equity among university students. So Chelsea, I'll turn it over to you.
Thank you, Dean Gooden. And I am delighted to have all of you all join us today for our session with Dr. Calvin C. Johnson. Dr. Johnson serves as one of the principal advisors to HUD leadership on research, demonstration, and evaluation activities, as well as oversees a broad evaluation portfolio to include projects exploring the impact of housing on non-housing and housing outcomes, such as economic self-sufficiency, health and wellness, educational achievement, and public safety. His portfolio includes demonstrations, evaluations, and research on housing discrimination, homelessness, aging in place, disaster resilience and recovery, community planning and development, as well as science and technology. Just recently in 2021, he was appointed by Secretary Marcia Fudge at HUD to serve on the Commission for Social Status of Black Men and Boys, which is housed within the U.S. Commission on Civil Rights. Dr. Johnson is also a fellow of the National Academy of Public Administration, where he serves as a member of the Standing Panel on Social Equity and Governance. And this panel is responsible for leading the performance of the Academy's social equity agenda, as well as co-sponsoring the Academy's annual Social Equity Leadership Conference. Dr. Johnson has also served in research, evaluation, and policy positions at the Court Services and Offender Supervision Agency, the University of Pennsylvania, the Urban Institute, and with the Executive Office of the Mayor of the District of Columbia. Dr. Johnson is also a part-time visiting professor of practice in the Masters of Public Administration program at Boise State University. Indeed, he is committed to increasing the pipeline of people of color pursuing careers in policy and program evaluation. It is my honor to present our speaker, Dr. Calvin Johnson.
Well, thank you for that warm introduction. I want to thank Dean Gooden for your continued leadership in the field of public administration and for being a trailblazer in the equity-centered public governance space. And thank you, Ms. Dunn, for your warm introduction. I really do look forward to our discussion. I understand that some of what I'm going to talk about actually is of interest to you, given your work within RISE. So let's get started. As a heads up, my discussion will attempt to tell the following story. And I'm going to tell this story in 4 points. I like 3 points, but I decided to add 1. Point 1, low-cost housing is disappearing. And for that, I'll be using data from the Joint Center for Housing Studies to highlight this point. Point 2, as a result of disappearing or the disappearance of low-cost housing or the low-cost housing stock, rents are becoming even more unaffordable, especially for those not receiving housing assistance. And renters are spending way too much of their income on rent. And for that point, I'll be using data from the biennial worst case needs report that is presented by PD&R's policy division. And specifically, I want to highlight exactly what I mean by worst case needs. Point 3 is that the housing safety net meets some of the housing needs among the very low income and the extremely low income individuals and families, but the safety net is not extensive enough to meet the volume of need. And for that point, I'll be using publicly available products that we develop within PD&R, and also just to highlight ways that you can use that data to link to other data sources, other administrative data sources that then really shed light on some of the challenges that folk who actually receive housing assistance actually bear. Point 4, with rent becoming less affordable and the strain on the housing safety net becoming more evident, we will see even more demand for homeless services. That is, our continuum of care and other support organizations will undoubtedly see more demand for their services. And for that point, I'll be leaning on the HUD's annual housing assessment report to Congress, which is managed by HUD's Office of Community and Planning and Development. So next slide, please. So let's start with point 1, the disappearance or loss of low-cost rental housing. And again, I want to pay particular attention to the Joint Centers report, which is entitled Americans Rental Housing 2022. Next slide, please. So as you can see in the slide, right, we have a rapidly changing rental housing market, and the changes are somewhat radical. Folks are moving into home ownership later. That means that renters are staying renters longer. Renters are staying renters longer. And it means that there are more higher income renters. Now, this chart from the Joint Center for Housing Study is about all renters and where the growth has been actually occurring within the rental market. The main point I want you to take away from this chart is that prior to 2010, all of the growth was amongst low income renters. See that there? All the growth was amongst low income renters. But now, the number of low-income renter households have actually declined as higher income renters have shot up about 48% over the past decade. Now, putting this into our current context, with rising interest rates and the continued development of multifamily housing and the falling development of single-family housing, I see the trend continuing, and we will probably see actually more rental housing available in the higher income brackets than in the lower income brackets. So that is, we're losing more of the low cost rentals. Next slide, please. Now, I was intentional about why I didn't show this slide first, right? Why I didn't lead with this slide as I was making the argument, and I'll explain to you why. So this chart shows that a number of multifamily construction starts. It shows the number of multifamily construction starts as well as those under construction reaching new highs, right? So you can see the line is trending. It starts to trend flat, then it goes down, and then it dips, and then it goes into new highs. But if I had led with this slide, that is, led by putting this before the previous slide, I might have given you the impression that we have nothing to worry about, right? And you might have said, well, we have plenty of supply because literally the housing construction is at a 3-decade high, and the actual number of new starts are also at highs, right? But if I had led with that and then told you about the loss of low income or low rent properties, you would have thought, well, what is the issue? And so I wanted to lead I was very deliberate in the way that I actually ordered these slides, because it's really about the loss of low rent units, and that is happening despite our 3-decade high in terms of construction of multifamily property, and I'll talk more about that shortly. Next slide, please. So why did I show the previous 2 slides in the order I presented? Well, I wanted to emphasize the Joint Centers data by basically showing that although we have production, we are still losing on the low rent side. And that slide showed that the bulk of the new multifamily rental housing is being built for higher income. So we have more construction happening, but we're losing lower rent units, which means that most of the construction is really happening for higher income renters. Now, unfortunately, with all of that construction, it is still not enough because the supply of low cost rental continues to fall, right? So not only is there more construction happening, but it's happening on the higher income side, the low cost rental continues to fall. Now, in other words, Previously, low-cost rentals are filtering to higher costs, that is, often with substantial renovations in order to make them much more attractive to higher income renters. In contrast, if we think about the Great Recession, we had hundreds of thousands of units filtering down to more affordable rents, and there were relatively fewer high rent units, right? But that's totally different now. We have more high rent units than we've had in, decades. Now, the market is completely different now. And it is clear that we're going to see more high rent units being the larger share of the rental market. And I am guessing, and in talking to economists at HUD, that this is likely here to stay. Next slide, please. Now, to make the point even further, this slide, again, from the Joint Center, shows that the loss of low-cost units has been nationwide. So it's not just in some areas, it's nationwide. And this has been an issue over the past decade. The trend toward fewer affordable units has been especially sharp in the West, right? There's 7 states, you see those dark red, burgundy, whatever you want to call them, states seeing a actual decline of at least 40% of their low rent units. Now, if we wanted to dive into this further, I can literally tell you that for Texas, Nevada, and Colorado, each of them, lost somewhere greater than 49% or more of their low cost or their low rent units, right? So this is a serious matter. We're losing low rent units, they're disappearing. Next slide, please. Now, I did something that I usually wouldn't do, and I did that intentionally as well, right? I usually want to lead with our stuff, so HUD, I work for HUD, so I want to lead with our stuff. But I thought that it was important. The Joint Center, they do great work. I thought that it was important to set the tone by saying, hey, look, we're losing these units. We're losing low rent units. And then I want to move into our discussion of the work that we do at HUD around worst case needs. Now, let's turn to point 2, worst case needs. And for point 2, the point here is that rents are becoming more unaffordable, resulting in low income renters spending too much of their income on rent. And again, I want to use the worst case needs report, which is a biennial report to Congress. Now, just some background here. The data source is the American Housing Survey. So HUD sponsors that survey. And the survey is actually administered by the US Census Bureau. It's conducted every 2 years, and it is a longitudinal survey of a sample of housing units. There's a 2-year lag between the collection of the AHS data, that is the American Housing Survey data, and the publication of the worst case housing needs report. So what I'm going to be showing or talking about would be the 2021 worst case housing needs report, which is based on the 2019 American Housing Survey. Now, some definitions, because I think it's important to have these definitions. Housing, or better yet, households with worst case needs are renter households who do not receive housing assistance. So these are folk who do not receive housing assistance and who have incomes at or below 50% of the area median income. That makes them very low income. And, right, conjunction, and they pay more than 50% of their household income on rent, severe rent burden, or they live in severely inadequate conditions, or they experience both rent burden and severely inadequate housing conditions. Now, to be clear, 95% of households with worst case housing needs have had worst case housing needs only because they had severe rent burden. So for purposes of discussion, we're talking about worst case housing needs in terms of folk who have severe rent burden, meaning that they're spending more than 50% of their income on rent. Now, one thing to note is that people experiencing homelessness are not included in the count of worst case housing needs. So this does not include the homeless, and I'll talk about that later. And people experiencing homelessness clearly have great need for they have a great need for housing, but they are not counted in the American Housing Survey because the American Housing Survey covers only housing units and the households that live in them. Now, I know that you all know this, but it's important for me to share this. I'm going to probably mention very low income households and extremely low income households. Very low income households are households at 50% of the area median income, and extremely low income are households that either have the greater of household incomes at the poverty level or 30% of the area median income. Next slide, please. So our long-time measuring stick for rental housing need has been our worst case housing needs. That is, very low income renters paying more than half their income for rent or living in substandard conditions. As I already mentioned, the cost of housing is the primary driver of worst case housing need. And HUD's biannual worst case housing need report shows that in 2019, that is pre-pandemic, there were 7.77 million very low income unassisted renter households with mostly severe rent burden, paying more than half of their income for rent. It is worth noting that the housing crisis of the Great Recession caused lots of folk to become very low income, which pushed up the worst case housing needs numbers. You'll see that in the 2009, 2011, right after the Great Recession, right? 2009, 2011, you see those numbers soar. So even though very low income counts have fallen, we still have high numbers of worst case housing needs. Next slide, please. Now this slide shows the number of households with worst case housing needs in 2019 across different racial and ethnic groups. So about 3.6 million of the 7.7 million households with worst case housing needs were non-Hispanic white households. 1.9 million were Hispanic households, and 1.6 were non-Hispanic Black households, right? And I can move on, you all can see that. Next slide, please. This one is important, so I'll spend a little time on this one. So on this slide, you have the blue bars that show the share of very low income renter households within each racial and ethnic group that experienced worst case housing needs in 2019. The orange bars show the share of all households within each group that experienced worst case housing needs in 2019. Now you can see that the rate at which households experience worst case housing needs vary by race and ethnicity. Native Hawaiian and Pacific Islanders households had the highest rate of worst case housing needs at 55% of very low income renters and 13% of all households. Next highest were Asian households and Hispanic households. Now, Black non-Hispanic households had relatively low rates of worst case housing needs among the very low income renters at 36%. Now you might wonder, well, why is that, right? Doesn't make sense. Well, this reflects the relatively high rate of housing assistance among very low income Black renters. However, looking at the orange bar, you see, and this is for African Americans, you see that the rate of worst case housing needs among all Black households was 10%, more than twice that for white households. Now, this reflects the fact that a much higher share of Black households compared to white households are very low income, right? Very low income members. And they rent their housing rather than own them, right? So it's all in the data and how we kind of compare them. Next slide, please. Now, as noted earlier, 95% of households with worst case housing needs in 2019 has had worst case housing needs only because they had severe rent burdens. Given the worst case housing needs are largely an affordability problem, access to affordable units or to units subsidized is critical to addressing the problem. Now, over the past 20 years, the unmet need for decent, safe, and affordable housing has continued to outpace both income growth and the ability of government to supply housing assistance and facilitate affordable housing production. Now, this results in a housing supply mismatch, especially severe for extremely low-income renters. The essential shortage is exacerbated because higher income households occupy many units that otherwise would be available to extremely low income renters. Again, this is this issue where higher income households are occupying units that would otherwise be available to low income renters. Now on this chart, the orange line shows the number of housing units available and affordable for every 100 very low income renter households. The blue line shows the number of housing units affordable and available for every 100 extremely low income renter households. So in 2019, there were only 62 units. There were only 62 units affordable and available per 100 very low income renters. So 62 available and affordable for every 100 very low income renter. The supply of housing was even more constrained for the extremely low income renters, with 40 units available for every 100 households, right? So there's just not enough supply that's affordable and available for very low income and extremely low income. And extremely low income renters did not benefit much from the modest growth in the rental housing supply between 2017 and 2019. So despite having growth in the housing supply, very low income, but particularly extremely low income households, renters aren't benefiting from it. Next slide, please. Now, I just want to kind of do a sidebar real quick and say that this is a powerful slide. And again, this is the Joint Center, and I just want to lean back on some of their work. And they produced this as part of their State of the Nation's Housing, right? Really good. I mean, if you haven't seen their work, I would encourage you to go to the Joint Center for Housing Studies website. They have really good reports up there. But I want to talk about this one because the Joint Center analyzed the consumer expenditure survey for low-income families. And it reinforces the message that rent-burdened low-income families with children spend less on basic needs than similarly poor households without rent burden. Specifically, low-income families with children that are severely rent burdened spend 35% less on food, they spend 46% less on clothes, and 74% less on healthcare. And this pattern looks the same for folk over the age of 65. So we have a similar pattern. I'm not going to talk about what the pattern is for folk over the age of 65. But when you're rent burdened, you just can't spend money on the other necessities. Next slide, please. So now I want to go to point 3, and I'm going to pick up the pace a little bit because I'm looking at the time. And here I want to talk about the housing safety net meeting some of the housing needs among the very and extremely low income individuals and families, but the safety net is not extensive enough to meet the volume of need. Next slide, please. Oh, I'm sorry, if you go back for a minute, I just want to highlight something. On the right-hand side, that is what I was saying. We actually have a product on the website. It's called the Picture of Subsidized Housing. And that's just a screenshot from it, but I would encourage you to go to the Picture of Subsidized Housing to just get it's rich with data. And you can get a sense of what subsidized housing look like at all levels of geography and for very specific programs that we have within our rental assistance portfolio. Next slide, please. And again, I'm going to pick up the pace a little bit. So this next slide, I'm just going to highlight maybe one important point and just kind of talk about some other issues here. So the important point here is that HUD's major rental assistance program only helps about 1 in 4 and slowly moving to 1 in 5, moving to 1 in 5 with respect to helping them avoid worst case housing. So right now, we're only able to basically help 27% of very low income renters avoid worst case housing needs because they're receiving rental assistance. When we start to look at updated data, there is talk of folk who are closer to the data than I am, that is starting to eke closer to 1 in 5. And so again, we're losing ground here. Now, we cannot have a discussion about HUD's rental assistance as a housing safety net without a discussion about the wait list, because I know folk know about wait lists. So the wait list might provide some insight into how folk go from worst case housing needs or homelessness to housing assistance. Now, we have little insight. You need to keep in mind that we have little insight into the waitlist management process for privately owned subsidized housing. So to be clear, wait lists aren't a great, they're not great for measuring need, but they are really important because they are the doorway into our housing assistance program. We have just one decent study about the wait list, which happened in 2014. And just so that you know, we actually stumbled upon it through our study of homeless preference. And then we know from a survey of PHAs about their wait list, we found that half of the housing choice voucher wait lists were closed, while only 8% of public housing wait lists, housing wait lists are closed, right? So they close these wait lists and they are pretty long. The survey found that there were about 2.5 million households on wait lists for the housing choice voucher program, and about 1.6 million on the wait list for public housing. Now, the actual reported average of length of time that people are on the housing choice voucher wait list before gaining assistance is about 28 months, while the average length of time for public housing is about 21 months. Now, where do people live when they're on the wait list, right? So all the places you might expect. They live in homeless shelters, they live with friends and family, they live in their own units, they live in their own unit and plan to stay in that housing for some period of time, despite the burdens that they might be experiencing. And they live in their own unit, but they want the vouchers so that they can move to a better unit or to a safer neighborhood. All right, so next slide, please. And I'll just highlight some things here. I just wanted to share here that we have about 4.56 million households receiving assistance from one of our major rental assistance programs. The median income is about $11,500. We serve about 9.14 million household members. 22% of them are elderly, 24% of them are under the age of 12, 47% of them are Black, 26% white, 20% Hispanic, and Asians make up, that number is wrong. I'm sorry, and Asians only make up 3%. Now this last point, let me just try to explain to you what I was trying to do in this last point here. Concentrated poverty, like 1 in 4 residents live in, if you're Black, 1 in 4 Black residents live in neighborhoods that are at least 37% poor. So 37% of the household are living at or below the poverty level. 1 in 4% of white assisted households are living in neighborhoods where 25% of residents in their community are at or below the poverty level. 38% for Hispanic and 28%. So just wanted to make the point that we see concentration as well. Next slide, please. And this is the point I was making about being able to link data and look at some other programs. So here we're looking at the US Census Bureau's Housing Pulse or Household Pulse Survey, which allows us to track housing needs in real time. And we link this to HUD's administrative data for our 3 largest rental assistance programs, that is the public housing, housing choice voucher, and multifamily assisted housing. The top level finding here is that fewer assisted households are behind on rent after the ERA, that is the emergency rental assistance program, than before. So the rental assistance program is helping folk who were really behind on rent before, but the ERA really helped lower the fraction of those folk who are behind on rent. And the second point is that we have fewer folk after ERA fearing eviction than before ERA. And this is amongst the assisted households. And the point that I wanted to make here is that we have the ability to use the data that I've been talking about to link to other administrative data sources. Next slide, please. All right, so let's turn to point 4, the final point, and I'll try to get through this quickly so we can have some time for questions. With rents becoming less affordable and the strain on the housing safety net becoming more evident, we will see even more demand for homeless services. So for this section, I'll be referencing data from HUD's annual housing assessment report to Congress, which is managed by HUD's Office of Community Planning and Development. Next slide, please. So let's talk about homelessness. So worst case needs does not count homeless, right? Does not count the homeless. So we need to add the number of homeless on top of the worst case needs. Now HUD counts homeless in 2 ways. The first is the point in time estimate, the point in time count, which founded on a single night in January, on January 2020, about 582,000 people were homeless. I'll talk more about that later. The other measure of homelessness comes from the Homeless Management Information System, HMIS, which captures an unduplicated count of people served by homeless providers in a given year. The most recent data we have from the HMIS was in 2020, when 1.125 million people in 960,000 households experienced sheltered homelessness at some time during the year, a sharp decrease, which is consistent with the point in time reduction from 1.456 million in 2019. Now, I do want to mention that about a quarter of homeless individuals have serious mental health issues, and about half of those, about 1/8 total, have psychotic issues. So the vast majority of homelessness is really about a housing affordability issue. Next slide, please. So now I come back to the point in time estimate, and just want to revisit these estimates here. So on a single night in January 2020, about 580,000 people, about 18 in every 10,000 people in the US experienced homelessness across the US. This is roughly a 9% drop from 2010. About 60% in sheltered location and 40% in unsheltered location. Now, since 2010, nationwide homelessness showed decreasing trends until 2016. And between 2016 and 2020, it steadily increased until 2020 due to the increase in unsheltered homelessness. Next slide, please. Now, more than 2/3 of all people experiencing homelessness were in households with only adults, that is 70%. More than half of them were staying in unsheltered locations. About 30% of the people experiencing homelessness were people in families, at least one adult and one child under 18. And most of them, 90%, were in sheltered locations. Again, individuals were more likely to stay in unsheltered locations than families. Nearly all veterans experience homelessness. Nearly all veterans experiencing homelessness were individuals. There's been nearly a 50% drop in homelessness among veterans between 2010 and 2020, and I'm not going to scoop any late breaking news that will be coming out from HUD on this one, but there is a lot to be excited about, and I'll just leave it at that, but there will be some late breaking news on the work going on in this space. Now, for unaccompanied youth, about 90% were between the age of 18 and 24, and 10% were under the age of 18, and about half were unsheltered for both age groups. Now, I just wanted to make a specific point about youth homelessness. Now, youth homelessness is a particular challenge for us. It matters a lot, but it's really hard to measure. And there's a gulf in terms of estimates between our official measure and what we're picking up from those who we contract with to come up with other estimates. And the range that we're looking at, it's a huge range, is between 93,000 and 4.2 million. Now, this is a pretty wide variance. And it varies. It goes from one project that we're funding, which includes couch surfing, came up with an estimate of 4.2 million. And looking at about 700,000 amongst those 13 to 17 and 3.5 million amongst young adults ages 18 to 25. HUD's 2018 point count estimates, looking at those on the street or in shelter, was about 36,000, a little bit more than 36,000. And HUD's 2020 annual housing assessment report look at unique unaccompanied youth homelessness seeking shelters over a year, had it at 93,000, which is a 23% reduction between 2019 and 2020. Now, we are interested in looking at a specific segment of the homeless population as it relates to youth, specifically youth aging out of foster care, and really trying to understand how they transition, especially between the ages of 18 and 24, because that could be, as we see for couch surfers and other young adults experiencing homelessness, that's where a lot of the challenges will be faced and they will encounter it. And so next slide, please. I think that is it for me. And I am so happy that I've had an opportunity to kind of share with you all this presentation. This is a presentation that I've been looking forward to sharing with you all for the last few weeks.
Thank you, Dr. Johnson. I'm sure I think everyone shares in my sentiments in terms of enjoying your presentation, and also just looking forward to the discussion which we're going to be having surrounding housing. And so you all please keep in mind that we have our Q&A chat box as well as the chat feature. So you're able to insert those questions in which you would like for us to engage in dialogue surrounding. But to start us off, a point in which it's really important for me when I'm thinking about housing and equities, and in particular thinking about renters, is around this loss in rent units and understanding where could we as scholars, as researchers, as advocates towards this, insert ourselves to intervene in these spaces. And so thinking in particular about Texas, and we know in the recent years how companies like Tesla and Charles Schwab have shifted their headquarters to Texas, which then brings in individuals who want to work in these types of spaces who, stereotypically have high incomes. And so we also know that with mortgage rates and just the competitiveness of housing market, we're seeing high income individuals now want to shift to wanting to rent. And so now they're taking these spaces and these units in which, very low and extremely low income individuals could, because also these property management companies are like, oh, well, now we can charge $1,800 for a 1-bedroom versus what we were initially charging of $900 to $1,200. And so what can we do thinking about this in our positions in which we hold? What can we do from a policy stance to intervene and to really raise awareness in how these inequities are quite structural, outside of thinking of the ways in which we can increase services and low income units available?
Yeah, thanks for that common question. I think that one of the areas that we're actually finding ourselves working on a lot, and it'd be great that if folk who are working in the social equity space will actually lean in and kind of provide some additional reinforcement, would be trying to figure out what are the strategies for kind of production of more affordable units. And so I have a group at HUD that focuses on specifically just that question. How is it that we can increase, or better yet, lower the cost of construction? And so they focus on building science and technology, and they're always looking for affordable housing designs and things of that nature. Another area is regulatory barriers. And so I think that especially folk who are looking at kind of racial equity issues, looking at how regulatory barriers really need to be revisited and try to figure out what are strategies to actually remove some of the barriers, modify some of those barriers, or better yet, modify some of the regulations associated with driving the cost of housing production up. And really thinking about things like, are the inclusion and exclusion like rules that we have in the book, are they harmful for the production of low cost rentals? And how can we revisit it and think about ways to not only actually increase production, but how can we think about strategies to actually preserve the affordable housing that we already have? I'm certain that many of the folk who are listening can point to a neighborhood that had low-income renters, right? And many of those low-income renters, at least in the area where I live in the Mid-Atlantic, are like neighborhoods we have large numbers of people of color. And those neighborhoods are like transitioning, turning over, and you see slowly and over time, more high income renters moving in. And so we need to be thinking about what are policies and strategies to kind of help preserve like affordable housing. And there are some really neat programs, and I'm not going to sit here and call them out, but I know that there's a program that looks at kind of low-cost structural grants to homeowners in areas that are really primed for gentrification, right? The bad G word. And the idea there is that they're helping owners stay in their homes, but also providing grants to them so that they can make these structural repairs to their home so that they can stay in them, right? So that they take pride in ownerships in those homes. And if you can get a number of residents taking advantage of those grants, and if we can make those grants available, then perhaps those blocks can actually stave off kind of that transition activity that happens, right? And so I think that there are a couple things, and it's not just in the government and public affairs space. We need planners. Well, first of all, we need engineers to kind of work with us to figure out ways to lower the cost of construction. We need planners to kind of help us think through regulatory barriers and fixes for that. And then we need to come up with creative strategies so that we can help people stay in their homes longer. Now, the last one I mentioned is really to keep owners in their homes, right? But that's important as well because owners in some cases sell and become renters. and so we need to kind of think about those issues as well.
I think you made a great transition to some of our audience questions, so I can chat with you this entire segment in terms of this and our shared interest in housing and making sure it's equitable and affordable for all, because that is indeed a basic need in which we have when you're thinking about this hierarchy of needs, with safety and shelter being one of them. And so one of our attendees asked in reference to HUD's Equity Action Plan and how it speaks to eliminating racial gap home ownership. And so addressing the disproportionate rates of homelessness and reducing bias in home appraisals. One of the attendees would like for you to share HUD's priority strategies regarding that.
Yeah, so I'm not the closest to it, but I can tell you that our secretary is a part of, I think they call themselves commission, PAVE. I'm going to draw a blank on what PAVE stands for, but the idea here is that there is an acknowledgement that we need to increase the rate of Black home ownership, and there's an equal acknowledgement that there is housing appraisal bias, right? And I will tell you that folk who work at HUD are not kind of like inoculated from that type of bias. I have had several conversations with high-ranking African-American homeowners who have recently, probably over the last year, had their home appraised. A couple of them have had their home appraised twice. And depending on who's doing the appraisal, you have a wild shift, and they have to ask the question, well, why is there a wild shift? And so I think that part of this is trying to understand and trying to control a lot of the discretion that is built into the system. And, unfortunately, appraisers are people, and we all bring our biases to the table, and there are biases that are in the appraisal process. There's just no way of getting around that. I think a more important question, and I had this discussion with at least one of the persons who had their home appraised, and I was thinking about this in terms of my community. My community is a fairly new community, fairly new. It was built probably 20 years ago, about 20 years ago. So it's fairly new. And I can only imagine, and we were just playing around with numbers, that if the average rate of undervalue in terms of appraisal was, let's say, $100,000, let's say, for the same home that's in a predominantly white community or development, you basically have about $300 million in lost wealth in our community, right? Lost wealth, right? And I think that we need to not only think about this in terms of the individual loss, we need to be thinking about this in terms of community loss. Like, what would $300 million say to investors who want to put a high-end establishment, right? We always talk about not having certain retail establishments or not having, the types of establishment we would want in our neighborhoods, right? Clearly, when they are doing their assessments and they're doing the research to make decisions about where to put a grocery store, where to put a Whole Foods, where to put a Cheesecake Factory, where to put whatever it is, they're looking at home values, they're looking at income, they're looking at a number of things. And so when you basically undervalue my community by 300 million, right, you're not only hurting my individual wealth, right? You're really hurting my community and everyone who lives in my community and their ability to basically have amenities that they're being denied specifically because of the color of their skin. And that just doesn't make sense, right? So I think that, there is a lot of work going on.
I see that. I think we may have, Dr. Johnson is actually joining us from South Africa, so we may have encountered a video or audio issue. We'll give him a couple of moments. But I think that many of the topics that he's talking about relative to some of the housing issues, and I saw in the chat, I know one of the questions was about homelessness among college students. And as we await him to join us, I know, Chelsea, you've done some research in that area. So maybe you can speak a little bit to that.
Yes, thank you, Dean Gooden. Yes, so one of the questions was related to how HUD is addressing housing insecurity for college students. And so that is something in which we at the Research Institute for Social Equity is wanting to explore more to understand the ways in which these programs can better support students in these challenging times, but also thinking even before the pandemic. I think if some of us think about our collegiate careers, we may have known someone who was facing housing insecurity as a result of termination of their room and board, which is very common, but as well as experiencing evictions. And so ensuring that we work with organizations such as HUD to incorporate, room and board within that as a resource, as a resource for students to be able to use some form of funding towards it. While there are scholarships and grants that we can use towards housing, if we do max out our, allowance, maybe having a separate segue for students to be able to use a small grant or pot specifically towards room and board. And so I too am very curious to see what perhaps strategies in which HUD has in place to address housing insecurities among college students, because it is on the rise. And with the pandemic and other additional stressors in which students are facing during this time, we are seeing an increase of housing insecurity among this population. And I do hope he is able to join us, because I was happy to see that question come across from you all regarding this, regarding that space.
I think the other thing that we should note for our audience is that HUD does have an equity action plan that really speaks to eliminating racial gaps in home ownership, addressing the disproportionate rates of homelessness, and reducing bias in home appraisals. I know the previous question was about talked a bit about home appraisals and the differences that we see there. So, I mean, seeing some of the work that HUD has done relative to its own equity analysis and identifying some of these troubling trends and its disproportionate impact on from a racial perspective has also been very critical to the work that HUD has done. So I think with that, we're close to the top of the hour. Again, we want to thank everyone for joining us. Chelsea, thank you so much for moderating. We thank Dr. Johnson in his absence. Again, he was very generous in joining us from halfway around the world, and we're glad that he didn't experience difficulty until the very end. So with this, I'll turn it back to Stephen.
Thanks, Dean Gooden, and way to pivot. We are, of course, experiencing some technical difficulties, but I thought the discussion was very great up until that point, and we really thank Dr. Johnson for joining us today. Again, thank you to our moderator, Chelsea Dunn. Thank you to Dean Gooden and our speaker. Thank you to our communications team in the background, helping us navigate this session. Please save the date for our next Lunch and Learn. That's going to be January 18th with Bob Holsworth. elections in 2022 and beyond. That should be a exciting discussion given our close of election season here. And we look forward to seeing you in January. And last but not least, happy holidays, everyone. And we look forward to seeing you in the new year. There will not be a lunch and learn session next month. So please enjoy your holidays and thank you for joining us this afternoon.